Hello everyone. I am Sanjana, onco nutritionist from ZenOnco.io. Today I shall be talking about pediatric stem cell transplantation and nutrition. In my last video, which I had done on bone marrow transplantation, we had seen that there are various complications which occur post transplantation, which could include loss of appetite or even nausea or vomiting, which can have an impact on the nutritional status as well. So, what happens because of this is that there is a reduction in the calorie intake combined with a catabolism if of because of the various treatments which the patient undergoes, and also the transplantation itself, which can rapidly deteriorate the nutritional status. Now, when we speak about children who pediatric population who undergo stem cell transplantation, so generally they have the common hematological cancers which include multiple myeloma or leukemia, or they have lymphoma. So what happens is that the pediatrics are mainly at a risk of malnutrition because they also experience a lot of adverse effects because of the underlying condition also, and because of the chemotherapy or the radiation treatment which they undergo. Malnutrition has seen to affect 10 to 50% of the children who undergo stem cell transplantation. Common side effects which have been observed are oral mucositis, nausea, vomiting, loss of appetite, or even diarrhea, which will result in the oral intake to be reduced rapidly after the first few days of their treatment. Certain medications which are administered also can cause side effects such as nausea or vomiting or loss of taste, which can also impact the nutritional status of the children as well. So, the severe impairment of the oral intake post transplantation can affect the nutritional status, especially in these patients. So it is very important to do a detailed nutritional screening to assess the patients, especially who are having uh, cancer in the pediatrics. So we need to do an early screening of these patients in understanding who are at a risk of malnutrition, so that we can give them timely nutritional intervention and ensure that they are also ready and prepared for the bone transplantation. So, if deficits are being observed in the nutritional support, including during a nutritional counseling, then oral nutrition support in the form of supplements or parenteral or enteral nutrition has to be initiated in order to avoid or minimize the risk of muscle mass loss. Now, what is the first form of nutritional support we see is that it is the intake of a well balanced diet along with protein and energy rich foods and fluids that are well tolerated. However, in some individuals, if oral nutrition is not well tolerated, then artificial nutrition has to be implemented. Now, in the pediatric patients, when they are mainly in the neutropenic phase, generally, yes, their oral intake is impaired because they might have other side effects like nausea, vomiting, or a loss of appetite, due to which their intake is reduced. And during this time, artificial nutrition is going to play a very important role. So, when is artificial nutrition indicated? It is indicated that it has to be given if the oral intake is reduced by 60 to 70% of the requirements. Now, enteral nutrition is the first line of the nutritional support in transplant patients when oral intake is not possible. So, why enteral nutrition is beneficial over Parenteral nutrition is that it will help in maintaining the mucosal gut integrity, and it will also help in reducing the risk of. So the next part we go to see is that what kind of a diet has to be given for the pediatric patients who undergo a bone marrow transplantations. Yes, it is a neutropenic diet, or what we call as a sterile diet or a low bacterial diet. It is very important to ensure that the food is well cooked and maintained at a room temperature to avoid food contamination or food infections as well. During this time, yes, hand hygiene plays a very important role. So they have to ensure to wash their hands even before and after eating, or even before any other task which they perform. Also, raw vegetables and fruits is not recommended as they can be a source of contamination. Already these patients after the therapy or before the treatment have a immunity which is highly compromised. So we need to ensure and that they are faced towards less risk of infections. Next, giving outside food or any processed or packeted food is also needs to be avoided during this time. If you are giving fruits, try and give them thick skin fruits rather than the thin skin fruits. So why is this? Because in thin skin fruits, for example, plum or a grape, so they are more um, prone to food contamination because of their thin skin. Rather, you can give thick skin fruits which are prone to less contamination. Ensure to wash the fruits and vegetables very thoroughly before giving it to the pediatric. So, to conclude, yes, nutrition care during a transplantation for the pediatrics is extremely important. It is also important for them to see who is at a risk of malnutrition and to give timely nutritional intervention as well. Also important is that it's important to manage the side effects and the symptoms. Thank you for watching my video. We at ZenOnco.io are always by your side while you navigate through your cancer journey. In case of any assistance, you can surely reach out to our cancer coaches with the below mentioned contact number. Thank you.